I've been a physical therapist for at least 34 years, and I really enjoy interacting with the patients and building a rapport with them so that they're comfortable. There are so many people that have told me that they look forward to coming to therapy, whereas before they would say, I hate to go into therapy, but here they really look forward to coming to therapy, and I enjoy that as well. I like to treat people the way that I would like to be treated. So I don't like to ever feel that I'm just a number. And I like people to interact one-on-one on a personal level. So I think that's how I run the business, that each person, I treat them as if they were my family member. That if a family member comes, I wouldn't treat them any better than I treat my patients. In this way, I find that we build a caring atmosphere so people can get better. Because therapy is not just about the physical ailment, but if you are also feeling emotionally supported and comfortable, it makes your recovery even that much better. Our journey with Stemwave began when we got the opportunity to have a Stemwave machine in our office for 3 months free, so to speak, to test it out. So I did my research and we looked up papers on PubMed that showed studies done on this machine, which produces a shock wave. And all the studies looked very promising. So we decided to try it for ourselves, and we did find that it really works. The normal physical therapy equipment that we have helps to decrease pain and swelling, and that is fine to help patients recover from injuries. But the Stemwave goes beyond that. It helps to regenerate tissue. So it helps with healing. It helps speed up the course of healing, different from what just the regular physical therapy machines do. So we do continue to use physical therapy machines, of course, but this just adds on top of what we can do here. There are some conditions that you treat it, you do the course of therapy, which would be like 8 visits of the Stemwave, and then the patients are better, goodbye, have a nice life, they're done. But then there's some conditions like the chronic arthritis, the bone-on-bone arthritis, that you do the first set of treatment and they get a significant improvement in pain, etc. But because it's so chronic, you want to continue maybe just once a month to maintain the benefits that they have gotten. Stemwave doesn't have side effects because it is non-invasive. But you wouldn't want to use it like over a pacemaker or if somebody has cancer, because you can help the tissues to grow more. So you don't want to use it with a cancer patient. But anybody who has regular, joint issues, musculoskeletal, then sure, this is what you want to use.
Hello everyone, my name is Steve Kornov and I'm a paramedic with Rapid Response EMS, and I came to Dr. Laura Hunter because I have a serious issue with my knee. And after only 8 sessions of Stemwave therapy, I feel great. I have no pain in my knee, I'm able to come back to work, full function, and it's really amazing. It is a miracle treatment. Highly recommend to everyone. Thank you.
One of the first patients we saw on the Stemwave machine complained of arthritis in her right shoulder. And so prior to doing the Stemwave, I asked her to raise her arm, and she did like this and suddenly dropped her arm. She was like, I can't. So we did the Stemwave all around the shoulder and in the armpit area as well. And then at the end, I said, okay, let me see you raise your arm. And to my surprise, she went like this. And her husband, who was standing watching, he was like, oh my gosh, it's a miracle. So that was just one of the things that really helped to sell us on this machine. Also, we've seen patients with knee pain. Just last week, actually, I had a lady who complained of 7 out of 10 pain in her knee. And after we did the Stemwave, I had her walk down the hallway and she was like, wow, I don't have any pain. So it's a real game changer, as they say. We also offer medical massage here. And it's not just the kind of massage that you go to a spa just to feel good, but it is an adjunct to the physical therapy that we do here. So the therapist who does the medical massage, she goes after a problem. Example, like if you're having headaches because you have such tight neck muscles, etc., she will get in there and help to give such relief. I always say about the therapist that we have here, she was placed on planet Earth to do this. It is a gift. She has what you call healing hands, and I recommend her without any hesitation. We open from 8:30 in the morning, and I take my last patient at 6:30 in the evening. So we close at 7:30 in the evening. The reason we do this is so that teachers can come in after work, and people who work until 5 o'clock can come in after work and have their therapy without having to take time off from their job. So I think it's really convenient for people to come in after work if they need to. We also take students at Quality Rehab Care from Nova, Southeastern University. So I help to train other therapists coming up. And it is a joy for me to pour into other people that way. And most recently, we've been taking high school students from Cypress Bay to come in and observe, shadow, help a little bit so that they get a taste of what it's like to be in a medical facility as they have goals to become a medical professional. So in that way, we're also helping to pour back into the community, and it really is our pleasure to do that. I also want to thank my past and present patients for all the support they have been to us, and for referring their family members and taking the time to write reviews for us. That has been fantastic. I have, I think, about 200 5-star reviews right now just on Google. There are also some on Yelp and other platforms, but that's amazing, and I'm very grateful for their help in putting good reviews out there.